This is Victor Abafe from A Healthier Democracy. I want to talk about restrictions on physician-owned hospitals. Only about 4% of hospitals are owned by doctors. When hospitals first started in the US, most of them were owned and run by physicians. In the latter parts of the 20th century, as laws gave funding for public and nonprofit community hospitals, the percentage of physician-owned hospitals dipped. In the early 2000s, as demand for specialty care rose, physician-owned hospitals had a resurgence. This growth has been stifled since the passage of the Affordable Care Act in 2010, driven specifically by Section 6001 of the Health Reform Law. This section of the law made new physician-owned hospitals ineligible for funding via Medicare and Medicaid, and mandated any existing physician-owned hospitals that had Medicare certifications would have to receive a special exemption from HHS to increase the number of operating rooms, increase the number of beds, or increase the number of procedure rooms. Given the impact of increasing consolidation and higher costs in the healthcare ecosystem, members of Congress are giving these restrictions a second look. The Patient Access to Higher Quality Care Act aims to remove the aspects of Section 6001 of the ACA that put a ban on Medicare and Medicaid reimbursement of physician-owned hospitals. Similarly, the Physician-Led and Rural Access to Quality Care Act aims to exempt physician-owned hospitals from existing restrictions if they open up within rural areas. Proponents of physician-owned hospitals argue that they will increase competition in healthcare markets, particularly within rural geographies. They will lower costs for patients, as a 2023 analysis of Medicare data found that for the 20 most expensive diagnostic treatment groups, physician-owned hospitals provided care that was 8 to 15% less than traditional hospitals. This would save Medicare over $1 billion a year. Many argue that doctors would be better entrepreneurs to lead hospitals, as they directly interact with patients and would have better ideas as to how to improve efficiency while improving the quality of care. Opponents, though, state that physician-owned hospitals are able to cherry-pick healthier patients and oftentimes don't offer a full suite of services that other hospitals do, like emergency services. As we look for ways to improve quality of care, access, and improve competition, it is very important that we look at existing laws around physician-owned hospitals as a potential avenue for reform.